Welcome back. What's something people don't know about India's healthcare system? I'm Dr. Nityanand Rao Patil, Senior Consultant Critical Care Medicine. A nation's true strength lies in the health of its people. Beneath India's economic growth and global achievements is a more fundamental story. In our health system, we've made remarkable progress, eradicating diseases like polio and saving countless lives. Yet immense challenges remain: disparities, overburdened systems, and unequal access. Health isn't just a policy issue, it shapes every family's future. When illness strikes, it can push families into poverty and rob children of opportunity. Our healthcare system is vast, with both public and private players, but access and quality still depend too much on where you live and what you earn. The COVID-19 pandemic exposed our vulnerabilities, but also sparked innovation and resilience. Now, we have a chance to rebuild stronger, more equitable, and future-ready. The choices we make today will define healthcare for generations. How do we ensure quality care for all, regardless of income or location? This is the journey to a healthier India, and our nation's future depends on it. India's healthcare is a mosaic, public and private, urban and rural. The public system is the backbone for millions, especially in villages and among the urban poor. Sub-centers and primary health centers are the first line of defense, handling everything from vaccinations to common illnesses. Above them, community health centers and district hospitals provide more specialized care, often with limited resources. The private sector, meanwhile, ranges from small clinics to world-class hospitals, offering advanced care, but often at a high cost. This dual structure creates a system where quality often depends on your ability to pay. The challenge isn't choosing between public and private, but making them work together. We need a strong public safety net and ethical, affordable private care. Only then can we ensure that every Indian, regardless of income or location, receives the care they deserve. The future of our health system depends on this partnership. Despite progress, deep cracks remain in our healthcare system. Chronic underfunding, just over 1% of GDP, leaves public hospitals overcrowded and understaffed. This leads to high out-of-pocket expenses, pushing families into debt and poverty. Many delay or avoid treatment due to cost, worsening health outcomes. The urban-rural divide is stark. Cities have world-class hospitals, while many villages lack even basic care. A shortage of doctors and specialists in rural areas means timely care is often out of reach. Quality and regulation are inconsistent. Unregulated clinics and unqualified practitioners put patients at risk. Stronger standards and oversight are urgently needed. These challenges, funding, access, and quality, fuel inequality and undermine our progress. We must confront them head-on to build a system that serves all. The stakes are nothing less than life and death for millions. The time for action is now. India faces a double burden: old and new diseases. We still battle infectious diseases like tuberculosis and malaria, especially among the poor. At the same time, lifestyle diseases, heart disease, diabetes, cancer, are rising fast. These chronic conditions require long-term, costly care, straining families and the system. Our health system must fight on both fronts, prevent infections and manage chronic illness. This demands a shift in training, infrastructure, and public health strategy. Prevention, early detection, and healthy lifestyles are key. We must integrate care for all diseases at the primary level. Only a comprehensive approach can break the cycle of illness and poverty. Facing these challenges, India launched Ayushman Bharat, a bold step toward universal health coverage. Its first pillar health and wellness centers, upgrading local clinics to offer broader services, from screenings to maternal care. These centers focus on prevention and early detection, easing the burden on hospitals. The second pillar, PMJ, providing health insurance up to 5 lakh rupees per family for the poorest 40%. For millions, this means protection from catastrophic medical costs. Implementation is tough, awareness is low, and quality varies, but the vision is clear. Ayushman Bharat signals a shift, healthcare as a right, not a privilege. Its success will shape the future of Indian health. We must ensure every eligible family knows and trusts the system. Strong monitoring and regulation are essential. This is our chance to make quality care accessible to all. The promise is real if we deliver. Technology is revolutionizing Indian healthcare. The pandemic accelerated telemedicine, connecting patients and doctors across distances. The Ayushman Bharat digital mission aims to create a national digital health ecosystem. Every citizen will have a unique health ID, storing medical records securely and accessibly. Doctors can make better decisions with complete patient histories wherever care is given. A unified health interface will allow seamless sharing of information, reducing errors and costs. Challenges remain: privacy, cybersecurity, and digital literacy, but the benefits are immense. Digital health can bridge rural-urban gaps and make care more efficient and patient-centric. We must ensure technology empowers everyone, not just the tech-savvy. Embracing this digital revolution is essential for a healthier, more equitable India. India has become a global destination for medical care. Patients from around the world come for advanced treatments at a fraction of the cost. Medical tourism brings revenue and drives excellence in private hospitals. But it also raises tough questions. Can we offer world-class care to foreigners while many Indians lack basics? There's a risk that resources and talent are diverted from those who need them most. We must balance economic gains with our duty to our own citizens. Policies should ensure private hospitals contribute to national health goals. Our first responsibility is to the health of every Indian. Building the healthcare system India deserves requires bold reforms. First, increase public health spending to at least 2.5% of GDP, an investment in our future. Strengthen primary care by fully equipping health and wellness centers. Embrace digital health, ensuring privacy, security, and access for all. Invest in digital literacy so no one is left behind. Regulate the private sector for quality, transparency, and ethical practices. Foster public-private partnerships to reach underserved areas. Only with clear goals, strong investment, and collaboration can we achieve universal health coverage. The time to act is now. Our nation's health depends on it. Our healthcare system's true strength is its people. Doctors, nurses, and community health workers. They work tirelessly, often in tough conditions, to save lives. We must address shortages and encourage professionals to serve in rural areas with better incentives and support. Nurses and allied health workers need greater responsibility and recognition. Community health workers, like ASHAs, are vital links, promoting health at the grassroots. Investing in their training, fair pay, and resources is essential. Health's passage is built in homes and communities, not just hospitals. We must empower people to take charge of their own health. When communities own their health, transformation follows. The journey to a healthier India is a shared one. We stand at a turning point for India's health. The challenges are clear: But so is our potential for change. Policymakers must act boldly. Funding, infrastructure, and patient-centered policies are essential. Regulate the private sector and build a public system we can be proud of. Healthcare professionals must lead with compassion, embrace innovation, and serve where needed most. Every citizen has a role. Demand better care, hold leaders accountable, and take responsibility for your health. Teach healthy habits to the next generation. A healthier India is within reach, but it requires a united national effort. Let's work together with courage and compassion to build a future where every Indian can live a long, healthy life. The time for action is now. Our health is our nation's greatest wealth. The journey is long, but together we can achieve it. The future of India depends on the health of its people.